Officials from the Limpopo Health Department spent the day being probed on the department's financial statements. Top of the agenda, reports by the Special Investigative Unit and the Public Protector on PPE procurement. Both institutions flagged wrongdoing in the awarding of a 125 million rand PPE contract. The SIU recommended that 4 officials, including the head of department, be taken through a disciplinary process. The head of department has since resigned. The current acting head of department is part of officials who underwent disciplinary processes following the SIU recommendations, a fact that concerns at least one SCOPA member.
We cannot go on to discuss something while we find that amongst us there's somebody who is implicated. If you go to SIU unit report to page 1, you will find that the current HOD have been taken to disciplinary hearing. Maybe if we don't have go to Mutewana Dombo, but if I read here, Mutewana Dombo, between Mutewana Dombo and the Department of Health, Health
MEC Dr Phophi Ramathuba told SCOPA that the matter relating to the alleged tender corruption in the PPE tender needs to be finalized, as it has been in the public space for too long. Ramathuba has admitted that there was political influence, but emphasized that she was not directly found to have done anything wrong.
Where you would find that there's political influence, which has been the issue on the space, that there was political influence, Honorable Maraga, towards the awarding of this tender. We are not defending anything, because all these reports that are said, let's refer to them, have not found any nepotism, any cousin, any daughter, any child of MEC Ramathuba, or any friend, or any colleague that would have benefited because of proximity with the MEC.
Another committee member, however, did not believe Ramathuba's explanation.
As much as we want to portray the image that the PPE was blown out of proportion, the Department of Health was in a way victimized, it's not true. There are issues that are relevant, and there are issues that must be drilled into on this investigation.
The department also accounted for a recently publicized coal tender. This after contracts were awarded for the supply of coal at hospitals that do not have coal boilers. The department says the contracts have been reallocated to facilities with boilers that are coal-powered.
We then requested a meeting with all the 14 bidders that had been awarded, and that meeting resolved that there be a reallocation of the 17 facilities that do use fire tube coal. That process has been done in agreement with the 14 bidders.
The department says relevant stakeholders have instituted civil proceedings to recoup some of the funds. Biman Baloi, SABC News, Polokwane.